we'll start with Aron and work our way towards me. This Aron Betru from Financing for Development.
Good morning, everyone. Very much appreciate being part of this discussion. So Financing for Development is a DC-based nonprofit that focuses on effectively designing, structuring, and implementing innovative financing ways of creating shared value in the ecosystem, to borrow phrases from yesterday. And I guess before I go through it, there's literally at the end of yesterday's session, a movie popped into my head. How many of you remember that Steve Nash movie, A Beautiful Mind, where they're thinking through how he came up with the Nash equilibrium? Maybe not politically correct, but a bunch of his buddies are in a bar trying to figure out how to approach women and what was the best way such that they all had a mutually beneficial outcome. And I was literally thinking of yesterday and saying it's similar to that. Effectively, when we were talking about creating shared value, it's getting to a mutually beneficial outcome for all parties. Now, the easy part is when you're dealing with private sector, private engagement, you have the decision makers at the table, so you're making sure that both parties are looking forward that mutually beneficial outcome. And I think a gentleman rightly said it in the Cincinnati example, that in the global health world, specifically in the developing world context, it's rare to have that beneficiary at the table. And so this issue around what are the incentives of those interventions that are being designed that you actually will result in a shared value outcome. And at the end of the day, when you listen to all the conversations we had yesterday, there was one bit that was actually driving that key switch. It was that leadership and vision. And in the global health landscapes, the things that we're seeing, you end up not getting that without some sort of external facilitator that's actually making sure that the key issues are being brought to the table. It's not an easy thing. This is actually a very difficult thing. The concept itself is easy, but in practice, actually execute is very difficult. But I'll give you a couple of examples of this. In one situation, we were engaged with Buyer Sharing, who was supplying a range of global health commodities to a number of donors and implementing partners around the world. And a number of these various agencies would come and approach and say, you need to lower your price, you need to lower your price. Now, this is a perfect example where the Nash equilibrium wasn't there, right? And when we were brought in to have a conversation, it was about how one of the things that the key stakeholders from Buyer kept bringing up was, do you know why our prices are where they're at? One day you'll tell us you're going to buy X quantity. 6 months later, that quantity's completely gone. And then 6 months right before Christmas, you tell me, oh, I need it in a week. Do you realize how disruptive that is to my business practice when you keep having this volatile environment? And sure enough, when we had a side level of conversation, we said, well, how does that manifest in your business? And at the end of the day, it was all about the logistics of actually delivering last minute that actually, in some cases, compounded to about being 40% of the overall intervention cost was the logistics side of it for them. It ballooned to that level. And so 60% went actually to the getting to the outcome. And when you ask them, well, how does this actually end up being realized by the different implementing partners or the donors? Oh, we take care of that. And I said, no. What you're doing is you're punishing your best customers, those donors, those implementing organizations that give you forecasts, and you're supplementing it, and eventually they're subsidizing your worst customers. You might need to think about coming out with a much more transparent pricing mechanism across the board. Give me 6 months of warning, this is what I'm pricing you. Give me 12 months of warning, this is what I'll price it. If you give me last minute, this is how I'm doing it. Be transparent. And it was actually rather a bit of a light bulb for Buyer Sharing when they realized how the flow of funds actually impacted their business model, and that was actually without giving the incentive to the different stakeholders that were in the room, was resulting in a disincentive for value creation. So yes, they did move forward. They actually implemented different price points, and it resulted in about 20% increased affordability across the board for their reproductive and maternal health drugs. That was just one a discrete example. The one that I always think about when you focus on shared value is something that we did with Merck. So they have this contraceptive implant, a little device that sticks into a woman's arm that provides coverage for family planning purposes up to 3 years, and there's other ones that go up to 5 years. Unlike what you and I do when we go home and buy a car or a house, maybe some of you will actually buy it out in cash, but for me, I finance it. I use a mortgage, use something to actually disperse that payment over my income. And in the space that we're in global development, whatever that product is, you got to pay 100% right up front. Does that really make sense? And when we approached a group of stakeholders that, once again, a bunch of agents were working with Merck to, you have to lower your price, you have to increase affordability, lower your price. And Merck was sitting in the room saying, our price is what it is. But a slightly different conversation emerged from our team with the finance team. And they said, well, what if we amortize the payment over the life of that asset? That's effectively what we do when we buy a car or a house. And they said, well, this is interesting. What does that actually look like? Effectively, what we ended up designing with them was, you took an implant, and we said, why don't I pay half now, and I'll pay you half in a year. We don't have to do it across the 3 years. Let's just split it up. Merck thought this was an interesting perspective, and eventually we got to an agreement, and we wanted a test case. At that time, the Ethiopian government roughly bought something like $6 million every year of this implant from them. And in 1 year, they were using World Bank money. In the second year, they were using the British government DFID money. And so we said, look, let's actually bring these two things together. It's $12 million procurement. I'll give you a guarantee that next year's payment will happen. We'll only pay you what the World Bank is going to pay you year one. Merck thought this actually made sense. From their perspective, that having that certainty of what their business was going to look like over multiple years was of huge value, and they were willing to do that, even cutting the price of the product. At the end of the day, from the Ethiopian government side, it accelerated the interventions that they were trying to do. From the donor side, it was a huge conversation about donor coordinating their interventions. At the end of the day, it was, I think, the largest ever procurement of this particular commodity that Merck had ever seen. And from the Ethiopian government side, it ended up being a 40% increase in health outcomes because everything was front-loaded for them. And at the end, yes, there was economic cost of everybody's time, but the actual financial cost became goose eggs, zero. There was no increased spend. Now, these are clean examples where you can actually start to see, wait, if you structure these things and interventions in a slightly different way, you can create increased value for all different parties. The issue is going to always be, what are the different incentives in the room? I think Dr. Khan from PepsiCo said it rightly yesterday. At certain times, the different stakeholders that are at the table, you're almost asking them to execute, but also disrupt themselves. And it's going to be a very difficult thing. And I actually was thinking, when we were talking about the conflict of interest presentation we just all heard, it is a very different conversation when you're talking about creating more value, which is what most people do for more money. It's a very different one when we're talking about creating more value for all parties with less resources. And that's the environment we're actually heading towards in terms of, yes, more private sector dollars are being put to bear, but ODA dollars across the board, there's less that's being spread across. Clearly, in the next 12 months, you're going to see a very different environment with more dollars going to humanitarian aid, largely because of the issues in the Middle East, and less money to development aid. So we're going to be reactive rather than proactive to fix some of these problems. Now, what does that actually mean when we're trying to create shared value? Luckily, it's not a hard thing once you've made that switch in various private sectors' minds. Now Merck is starting to ask itself its question, wait a second, have we always just been selling our products rather than selling the outcomes? So there's a number of different products that they have where you actually need to have a minimum number of usage, whether it's HPV with minimum number of regimens, or TB drugs, or other things that you need to have a minimum number of usage. So for them to sell one usage, the conversation becomes, well, how much can I get for this funding envelope? Rather than saying, this is what you need as a package and the health outcome. Well, that forces then Merck to think through their pricing mechanisms for these different products. So from a donor's perspective, they start to ask themselves the question, okay, to actually get the health outcome, I need to make sure I deliver this minimum threshold that will guarantee, and then it becomes a much more apples-to-apples comparison across different interventions. Merck is thinking, and I sound like I'm advocating just for Merck. I don't own a Merck stock, by the way, from a conflict of interest perspective. But nonetheless, there are other organizations that are out there that are having these exact same levels of conversations about how to change their business practices in a way to look at creating shared value. The role of what we heard yesterday, which were very much outliers, how do we get other organizations to make that switch to start thinking in that way, is going to come from, unfortunately, not from within, but it's going to be outside facilitators either advocating for or keeping them honest effectively to make sure that you don't have, I guess, a realization of the WHO practice on what they think of the private sector. It's going to take a slightly different group of actors in the room. So at the end of the day, I guess from my perspective, I would say the lessons learned from the impact that we've seen is the incentives really, really matter, and thinking through who are the different folks who are really trying to move the needle on. And if you do have good stewards of the key set of incentives at the table, you can easily create shared value. This is not a complex thing in theory. It's just making sure in practice that it's well articulated and designed from the beginning.
Thank you, Aron. Pass it to Abby from Care USA. She'll talk a little bit about her experience.
Yeah. Thank you. Good morning, and thank you all for inviting me this morning. How many of you have heard of CARE? All right, a good part of the room. How many of you have heard of a CARE package? Or sent one, or received one? So back in 1945, 70 years ago now, CARE was founded with 22 US organizations who came together to send care packages to war-torn Europe and Japan. And so that's our legacy. It's a great example of American generosity. Obviously, since then, though, we have evolved tremendously. Today, we are not about handouts. We are about delivering lasting change through sustainable implementation of development programs across a wide variety of issue areas: health, food and nutrition security, gender-based violence, and empowering women and girls. And I would say if we had to sum up what we do in a sentence, I would say that we fight global poverty by empowering women and girls to bring lasting change to their communities. So why do we engage with companies? We have engaged with companies through philanthropic relationships for many, many years. But in the last 10 to 15 years, we've really been shifting toward shared value models, in part because that's where companies have been moving, but in part because we understand that we can realize far more impact on the ground by engaging companies through a variety of entry points. So several years ago, we developed what we called our multi-asset model, where we work with companies in supply chains, in distribution and services to poor communities at the bottom of the pyramid, working with workforce on gender equity and diversity training, and other ways to engage employees, and then brand and communications efforts to engage consumers, and finally working with government relations teams to align on advocacy issues that are of mutual interest. We just, our CEO, Michelle Nunn, just wrote an op-ed with the CEO of Kellogg on passing the Global Food Security Act that's hopefully will be before the US Congress soon. So it's finding those shared opportunities. Our most innovative work in shared value is certainly in a company's value chain, so the supply chain, workforce, or distribution and sales to poor communities. I will, in full disclosure, say that with the health and pharma companies we partner with, we have not found that alignment in a company's value chain. We work on sexual, reproductive, and maternal health, and we do some work on HIV/AIDS. In terms of aligning with core business, that's not a focus on chronic diseases, that's not a focus on health sector strengthening. So the partnerships that we have with our valued partners in the health and pharma sector have been around strategic philanthropy. And we love that, we value that. But today, the lessons that I'll draw from on shared value come from our partnerships with food and ag, with financial services, with apparel, and with fast-moving consumer products. So a couple of quick examples. Actually, before I do that, I'll say my one message today, if you take nothing else away, is that shared value efforts, in our experience, are fundamentally change initiatives in companies and in NGOs. They mirror each other. Our team is working a bit on the margins of what CARE does. We are pushing the envelope of what CARE's core business tends to be. So instead of implementing a development project, we're pushing to align with a core business imperative and find those mutual benefits. The partners we work with in companies, on sustainability teams, on business innovation teams, occasionally in business units, are doing the same thing. They are pushing the edges of what their businesses are doing. So together we are learning with our allies in companies about how you make these processes work. And to pick up on Aron's great points, it's about incentives, it's about attitude and culture change, and it's about defining the right models from the beginning with the right stakeholders in the room. So a couple of concrete examples. We're partnering with PepsiCo on the supply chain side to integrate gender and nutrition into their potato supply chain in West Bengal. And that's addressing a couple of key issues. So one, 90% of the women in their potato value chain are anemic, and we know that the men are not getting full dietary diversity either. We also know that women are making crucial contributions to the potato chain that are not necessarily recognized, and they're not necessarily receiving the training and resources that they could be to become more productive, to generate better livelihoods for themselves and for their families, and to improve efficiencies in PepsiCo's chain. So we are looking at all of those linkages along that very upstream portion of the value chain to address these issues. If this pilot shows the results that we hope it will in terms of productivity, efficiency, and benefits to the community, it's something that PepsiCo hopes to scale through their sustainable farming initiative, which runs across all of their key agricultural ingredients. So that's a terrific opportunity for all of us to see if we can get this right. The reality, though, is that not all of what CARE wants to see in terms of development impacts will have a business case. I think we need to be upfront about that. We've seen that in the PepsiCo work, we've seen it in our apparel work, where we are delivering training and really a full curriculum to women who work in factories so that they can become literate, financially literate, and basic literacy. We do some health training to raise awareness of connections to health centers, reproductive health options for women in factories. But the bottom line is we're trying to get a factory owner, or we're trying to get a PepsiCo business unit lead to say, this investment makes sense for me financially. And at the end of the day, I think that there are areas that CARE would like to see that would have development impacts that simply don't have a business case. So that means that we need to figure out what we're willing to live with as companies work to scale these approaches forward, and where we can get supplemental funding that isn't going to come from a business unit to address those aspects that really are public goods. So how do we get that balance right is something that's top of mind for us. A couple of challenges to share with you. First, as we have moved as CARE from working primarily with corporate foundations to working with business units, innovation teams, R&D, others inside a company, as you know, they have considerably lower budgets than a foundation would have at their disposal. So we're working with smaller budgets, we're working with shorter time horizons, and very little room for error to prove the concept that we aim to prove on the ground. And yet, these are the most innovative initiatives that we're doing in the sense that they're pushing us the most out of our comfort zone. So we need the right expertise in these projects, and that expertise isn't always available with the budgets that we have. So we need to think about our own business model, how we write our budgets and resource these activities, and where there might be supplemental expertise that we could bring. So that's an area where, as others have said, our corporate partners can help provide some of that expertise. Sometimes it has to come, though, from outside care and outside a company with somebody who's been in that translator role, who knows development and who knows how things work in a business. So one example there, we're working with a fast-moving consumer goods company to develop a distribution and sales model in rural Kenya that will include products that are needed by the community, that will hire women to deliver the products and to be sales agents. To design this, we have an entire team from our corporate partner from a variety of functions who's worked with us from day one, and CARE has a team as well. We've sat together, the company invested a certain amount of money in a co-design phase before we even started. So we were comfortable with the design, and then have actually started implementing the pilot. So it's doing those investments up front where you have the right actors around the table to really negotiate how this is going to work that has worked best for us. In terms of supplemental funding, and it'll be interesting to hear, Wendy, from your perspective for sure, we love to find opportunities where we can align with USAID, corporations, and CARE, but we found that that's been tricky in terms of lining up timelines, in terms of lining up funding might be available in USAID at a different time from when a company is ready to go. So that's been really tricky to thread that needle. The other issue that's come up is that the fast-moving consumer goods company that we're working with didn't want to go to any outside funder like USAID or like a foundation because of proprietary interests. So they said, well, maybe if you have an individual donor who's really hands-off and really willing to sign all sorts of agreements with us, we could see that happening. But the bottom line is we can't do a multi-stakeholder initiative for our business unit to distribute. So then we're a little bit hamstrung because we need expertise, we need a bigger budget than we have, and we're trying to deliver on a very short timeline. And finally, I'd say, back to the example of bringing together a team that I just shared where we did a co-design with teams from both the company and CARE. This is a mindset shift in the sense that the companies that we work with often are used to thinking of relationships in their supply chain or in their distribution and sales channels as vendors. So a lot of the people we work with are thinking, well, we wrote a scope of work, can you CARE just go and deliver this? We'll have calls periodically and just let us know. Work is too innovative for us and for our corporate partners to not have that kind of investment with a team, with a co-design, with people coming together and really learning and adjusting as we go. It's not something that's where there is a playbook and we can just go and implement. And so that's an important shift and part of the change initiative that I'm talking about that needs to happen inside companies. The last point I'll share is that back to the idea that these are change initiatives, we often have tremendous champions at headquarters or in a global function, but getting buy-in from business units on the ground is a separate conversation. And so there might be great will, there might be funding available, but then figuring out how we involve business units at the right time is an ongoing learning experience for us. And that's a question that we're living with our partners. So in some cases, we have pilots that are taking place with no engagement from a business unit on the ground, and then the idea would be if we prove the concept, the company can then sell this to their business units. We have other cases where we're not even working in a corporate supply chain, but we're looking to prove the model to say, okay, if you empower women farmers in this value chain, let's use that as a case to then go to our business units. And then there are other cases like the Pepsi example that I shared where we just jumped right in and are piloting with the business unit on the ground. So I don't have a right way to do it at this point. I think it's whatever the companies need, but I would like over time to see some lessons emerge that start to clarify some best practices in that space. So that's where we are as CARE, and I look forward to the rest of the discussion.
Thank you, Abby. Great perspective from an international NGO, and now we're going to turn to John Sargent, who runs a social enterprise in health, and he'll walk us through his views. And then we also have the representation from philanthropy and government. So we've got a great diversity of opinion on the panel this morning.
Great. Thank you so much. And I want to thank the Institutes of Medicine for inviting Broadreach to talk about sort of our views on shared value. So I'm going to take a slightly different approach. When I was preparing for this discussion, Rachel gave me a whole list of questions that I needed to answer, and they sort of boiled down into a couple of key questions. The first is, how have we as an organization changed and evolved in order to facilitate and catalyze shared value? The second thing was, what are some of the things that we need as an organization to be successful? And thirdly, what are some of the challenges? So I'm going to talk about that from a personal perspective, from my own personal journey as a social entrepreneur over these last 13 years, and try to give you some hopefully concrete examples. And I'd like to leave you with 3 key takeaways. I'll tell you up front so we don't get lost in the dialogue. The first is that information is absolutely a critical catalyst to shared value. And I'll talk about that because it's very important for sort of our evolution as a company. Secondly, is that entrepreneurs and social entrepreneurs are going to be a major driver of innovation. And I think there is a lot of opportunity for multinationals to really partner in more significant ways with entrepreneurs. And then thirdly, we're not quite there yet in terms of shared value. I think we still need to get a critical mass before we see the shared value revolution take off. And I'll talk a little bit about that in the context of the challenges. Okay, so the first point, information is a key catalyst. I think we had some great presentations yesterday from Ali and from Ron and others that talked about how information is absolutely critical. When we started Broadreach, so I started Broadreach with my best friend from medical school, a guy named Ernest Darko. So Ernest and I, we're thick as thieves. We became best friends early on in medical school. I have an interesting background in that I'm half Asian. I was actually born in Taiwan, and I spent my life, because of my father's job, moving around quite a bit. And as a result, I had the opportunity to see and experience lots of things. And when I was in college, this was the summer of 1992. I had a great opportunity to go to Sierra Leone. So as many of you, I don't know if people have seen Blood Diamonds, but it was based on Sierra Leone. And in 1992, it was in the midst of a horrible, horrible civil war. And so I went as a naive 21-year-old, and I worked in a really rough condition, in a little tiny village called Shibwema in a refugee camp. And I remember there was no running water, so we had to go to the river and get water. We had to take bucket baths. There was no electricity. But if you wanted Coca-Cola, if you wanted Pepsi, if you wanted beer, you could always get it. If you smoked cigarettes, you could get cigarettes. And so I started asking the question, well, how is this possible that people are dying, but yet we can get soap and soda and cigarettes and beer? And so that sort of stuck in my head. And then, fast forward a few years later, I was in medical school, and Ernest and I were very good at procrastinating. And so we would pull all-nighters before big exams and usually never study. We sort of always talked about, well, what are we going to do when we grow up? How are we going to save the world? All those things you talk about as a student. And he, his parents were from Ghana, and he was born in the U.S. but grew up mostly in East Africa and came back to the States for school. And he had the same sort of experience. I grew up in Africa, and I saw all these aid organizations, and I saw all these donors, and really the organizations that create sustainable development are the private sector companies that hire hundreds of thousands of people, that give them job skills, that create products that are actually sustainable. Whereas on the donor side, we've lagged in public health care. And the work we have done wasn't sustainable. Now, this is 20 years ago. So we started this idea, well, what is it that the private sector knows that we don't know? And so we started that quest, and so we finished our medical degrees, and we both became management consultants. So instead of doing residency in internal medicine, I actually turned down my offer, and I actually went into management consulting in New York City with the idea that it would be a residency in business. And so fast forward, 4 or 5 years in the consultancy, Ernest he was at McKinsey at the time, and he went to Botswana. At the time, Botswana had one of the highest incidence and prevalence of HIV in the world. And fortunately, Botswana exhibited great leadership in saying that they would treat all people who were HIV positive. And so McKinsey came in, and the Merck Foundation came in, and Brenda was involved, and Honorable Minister Joy Pumapi was also very involved, as well as the Gates Foundation. So Ernest called me. I was in Washington, D.C. I flew down with my miles, and we said, you know what? There's a huge opportunity here to take what we've learned and to take this private sector management consulting thinking and work with governments and donors. So that's how we started. We stupidly quit our jobs. And for 3 years, we had no revenue. We just literally lived off our own savings, off people's couches. But we had this vision. We wanted to improve access to health care for underprivileged populations, but we wanted to do it by bringing this type of thinking and merging it with the best of public health care. So fast forward 8 or 9 years, we grew to 250. We're about 300 people today. 98% of our staff are in sub-Saharan Africa. And we looked like a very innovative NGO doing really cool public-private partnerships, partnering with insurance companies, providing capitated care for HIV patients, doing lots of interesting things. But we sort of pulled back and we said, well, are we going to have the impact that we wanted to when we set out to do this? I mean, we could go from 250 staff to 25,000 staff, and we could work in all the rural clinics all over the world, but are we really going to make a change? And we answered, no, actually not. And then we asked the next question, which was, well, what could we do that would really provide the change? And we looked back at our history and we said, well, the thing that we do really well is information, because the type of work we're doing, and USAID is one of our biggest supporters, is going into government and fixing health systems. But you can't fix health systems if you don't know how a clinic is performing, what's going on in that clinic, and how to fix it. And so we built up all these, our own IT systems and software systems to really analyze clinics and analyze what was going on in the country. So we said, you know what? We believe that there is a power in the private sector finding sustainable business models, and that's what we are. We're a private company, but we're focused on social issues. But for large multinationals to really find opportunities and create business models to solve social problems, as well as, and that can't be done without partnership, and that means government, that means donors, that means NGOs, that means multilaterals. But the one key that we felt that we could really contribute to that is information. And so why do I say that? So if you go talk to the president or the minister of health of a country today in sub-Saharan Africa or in other developing markets, you ask them, what's going on in your country? What are your priorities? What are you not doing well in? Where should you be investing your money? When you go talk to donors, and donors, we've been very blessed in this whole phase of PEPFAR to have phenomenal support, and I think the evolution of public health care has grown dramatically due to those types of efforts. But even still today, you go to donors, and there's lots of reporting, lots of data. But you ask them, well, what's really working well in Tanzania, and who has a great model for this? It takes a long time to figure that out. We do a lot of work with pharmaceutical companies trying to figure out business models. How do you get your product, or what are the types of products and business models to get to people at the base of the pyramid? But again, the thing that hampers medical devices and life sciences companies is lack of information. No one is going to make an investment if they don't understand the ROI. That's just the fact. And not only that, but who are the people on the ground? Who can I trust? Who do I partner with? What are the rules? What are the regulations? So when it all comes down to, for us, is we believe one of the big catalysts for encouraging organizations to partner and to create shared value models, it's information. And so if you look at us, where we were in 2009, 2010, and where we are today, completely different organization. So we made the decision to focus on information. We have built out, and I'm not a technologist, but it's fun to say this, we have a cloud-based software as a service analytics platform. And basically what it means is we decided to build what we're calling the Bloomberg terminal for the development industry, or the SAP for the development industry. And so today, in one of the largest countries we work in, the Minister of Health, key people down to a district level, can log in. They have their personal dashboards. They see what's going on. And it's not about data points and visualizing data. It's about information and insights. What I need to know on Monday morning as a district manager who's responsible for 1 million people is, what are the 5 things that aren't going well, and what do I need to focus on? That's the type of stuff I'm talking about, so they can log in on their cell phone, on their computers, to get that information. It also provides reporting. So many of you who work in sub-Saharan Africa know that staff spend 2 to 3 weeks a month just gathering reports. Nobody knows where those reports go and what happens to them. So how do you take that information and make it meaningful? Predictive modeling, what's going to happen over the next year? Are there going to be a higher rate of defaulters in HIV? Are there going to be a larger number of deaths? For pharmaceutical companies, we're working with a couple in this room on our platform, helping do market sizing, market analysis around products. For NGOs, we're actually licensing our system out so that they can actually run and manage their performance much better and do their reporting to USAID. To multilaterals and large initiatives, we're involved in one called Access SMC, which is a malaria program that provides seasonal malarial chemoprophylaxis. That basically means for children 5 years old and under, there is medicine you can give them at the beginning of the malaria season to help them prevent getting malaria. Now, the challenge is it's a very complex ecosystem, right? You have, in this case, a number of countries in West Africa. You have donors, you have multilaterals, you have NGOs, and you have the pharmaceutical manufacturers. So how do we all sit down and agree on how much funding do we have? Where are the kids who need the drugs? What should our forecasting be? How do we do it? So again, using our analytics platform, pulling that all together and giving that information so that you can log in as the Minister of Health, you can log in as the VP of Manufacturing for a pharmaceutical company, look at the estimates, talk to each other, create dialogue and discussions. So I think that's been a really big evolution for us. Now, when we were talking about this, Ernest and I didn't call it shared value. I think this was right when shared value was starting, but I think we'll take credit in this meeting that it was deliberately for shared value. But again, we have completely rebranded the company, refocused on information. So that's the first point on information is a key catalyst. The second is entrepreneurs as a major driver of shared value. So I think there are great models today in the pharmaceutical industry and R&D where pharmaceutical companies invest and partner with startups to develop new compounds. When you look at, and I think Dr. Zhao described this very, very well, I think the work that Beth is doing in impact investing, the work that Aron is doing, we are coming across a massive, I'd say the last few years, and I think it'll increase, a big wave of social entrepreneurs locally on the ground who are figuring out models that work to solve problems. And these are people who are connected to the ground, they know what's going on, they know what works, they know what doesn't work, but they don't necessarily have the capital to scale. They don't have the know-how, and they may not have the technological support. And I think there is a massive opportunity for private sector companies, multinationals, to be more deliberate and thoughtful about partnering with entrepreneurs as a way to create new business models, whether it's through strategic investment, whether it's through partnering, joint ventures, providing human capital. I think this will be a very, very rich source for innovations and ideas for shared value. And I say this, I'm biased. I am a social entrepreneur. And we have grown this organically, but to get to the next level, we have to do it through partnerships. And I think there's a great opportunity, instead of a multinational sitting 8,000 miles away trying to figure out a theoretical problem, to actually partner and invest in groups that are actually doing this. Then the third point is that I don't think we're at critical mass yet, but we need to get there. I think there's a lot of challenges doing this, and we've heard a lot today. I think one of the biggest challenges are perceptions and attitudes. I don't think people really understand what shared value means, with the exception of probably people at the very, very top and other enlightened folks. And I look at this like technology adoption. So when the iPhone came out, there were the diehards, the people who'd camp out 3 days in a row in the rain and the snow, and we're the diehards, we're the campers, we need to get to a critical mass where we have data. For example, the work that Ron is doing, I think that's absolutely critical. The case studies that we've talked about here, to really change attitudes, to say this is actually a new way. It's actually not even a new way of doing business. It's just good business. You're solving problems in an economically sustainable business model that's profitable, and that, by the way, does a lot of good for the world. So I think we need to keep doing things like this. We need to keep publishing research. We need to keep publishing case studies. We have to be relentless, and we have to get to that critical mass so that we can sort of flip the switch over and change the attitudes amongst all the different stakeholders. So thank you very much, and I look forward to any questions and hearing the other discussions.
Thank you, John. We'll now turn over to Marjorie Paloma from the Robert Wood Johnson Foundation to provide the perspective from philanthropy.
Excellent. So I want to build on some of yesterday's discussion on shared value, this notion of the private sector reinventing itself to meet the needs of society, finding the opportunities where our values align, and how incorporating purpose can drive economic growth. And what I'll do is I'll share with you a couple of examples, and then I want to share with you how we at the Robert Wood Johnson Foundation have had to shift our mindsets and had to shift our processes in order to be open to partnering with the private sector. So as many of you in this room know, for the past 2 years, we at RWJF have focused on building a culture of health in America. and really working towards a society where health is a shared value for all. Now, to get there, we know it will take many different players, those in government, those in the social sector, those within the private sector. But again, we're looking at this from across all sectors: housing, transportation, urban planning, architecture. We see the connections between all of these things in health. It will require healthier, more equitable communities and strengthening the integration between the health and healthcare systems. We know it will take a national movement to achieve this. And that's why we know, too, that the business sector, by the virtue of its vast size and its ability to drive cultural change, must be at the table. So in fact, to accelerate a culture of health, engaging business is not only essential, it is a consequential step. So we see an opportunity, but more importantly, we feel an urgency to work with partners in business to achieve shared value. And we believe that business, and we've heard it all day yesterday, we see that business sees this opportunity as well. I want to share with you the example from the Sports and Fitness Industry Association. Now, this is an umbrella group that serves over 1,000 brands in the sports and fitness industry. Now, think about all of the big names. They're there, as well as the smaller names as well. Now, this group, for years, has focused solely on promoting the sales of sporting goods. And it was last year that their board took a closer look at physical inactivity. Now, what they saw was data showing the upward trend of inactivity. These were 80 million Americans who were totally sedentary. That means didn't move at all in terms of the course. They didn't see themselves doing any exercise. And they forecasted that out. I know, drastic numbers. They forecasted that out to 2018, and what they saw was that number grew to 92 million Americans. That's 31% of the U.S. population not moving. Now, these new inactives will purchase $28 billion less in athletic footwear and apparel and equipment. That was the conversation. But America becoming less active has a direct impact on their industry, on their bottom lines, on their companies' very existence. And to reverse this trajectory, these companies will have to focus on changing the culture in America. And so they've redefined their mission to really help build a more fit America. And we know that this will undoubtedly influence their members' profitability. It also aligns with the culture of health. You know, many of us in side conversation we've talked about how the time is ripe, how businesses are turning more and more towards addressing social issues. For example, 91% of consumers expect companies to address social and environmental issues. Consumers, purchasers, customers. According to a 2011 study, 3 out of 4 young adults believe that corporations should create economic value for society by addressing its needs. So millennials, they make up the largest segment of the U.S. population, and they believe that business needs to reset and should focus more on the advancement and well-being of society. More than half of them have said that they would take a pay cut to find a job that matches their values, and 90% say they want to use their professional skills for good. Yesterday, we heard a little bit about impact investing, and a recent report showed that investors, including the corporate philanthropists, have committed $10.6 billion to impact investments last year, with plans to commit more. We've been hearing more and more from the private sector that they want to focus on health and well-being, that it's important to them, not just for their employees, but to attract the best talent, to support parents and families, and to make sure that the communities in which they work, in which they thrive in, have opportunities for growth. So a couple of examples where we're seeing the opportunity where health and businesses align include the American Heart Association. So they have formed a CEO roundtable, which includes more than 20 leaders, CEOs from companies as diverse as AT&T, Walgreens, Blackstone, Humana, to consciously create workplace cultures that will help 2 million workers make behavior changes to improve their cardiovascular health. And in 2014, we at RWJF funded a study for the Healthy Weight Commitment Foundation. This is a group of 16 of the nation's leading food and beverage companies, like General Mills, PepsiCo, Hershey's, Kraft, the big hitters. These companies pledge to address childhood obesity by taking out 1.5 trillion calories out of the food system. Now, yesterday we talked about how do you verify these commitments? How do you make sure that companies are being held accountable for their work, their words? And what we did was we took a closer look. We evaluated that. We found that these companies not only met their goal, they exceeded their goal by 400%. They took out 6.4 trillion calories a year early from their commitment. We've also funded studies that have shown that companies that have that sell healthier products are actually more profitable, and they have better reputation with their consumers. We're all familiar here with CVS's health decision to stop selling tobacco products, and many folks decried the decision as a financial risk. But in fact, CVS's sales have grown since going tobacco-free, with a net revenue rising by more than $6 billion in the first half of this year. We are proud to be a part of the announcement, and we'll work with others to follow in these footsteps. Now, it's clear that creating this new culture of health will require all of us to think and work differently. It means finding common ground and leveraging the power of resources that are available to us to create positive good. Business is one of the key drivers of culture, can reach every individual in America. They can shift cultural norms and shape the national dialogue on health. Now, I want to share with you another example. Think of an iconic brand, Apple, and the research kit. So Apple didn't just release their iWatch. They released a software framework, speaking of information, together with our grantee, Sage BioNetworks, that helps doctors and scientists conduct medical research by collecting data more frequently and more accurately from people who are using mobile apps. So if you imagine a phone being able to sense tiny tremors or symptoms of Parkinson's disease and connecting that patient data to secure private platform that allows researchers and policymakers to understand a variety of health issues and the actions needed to improve health. These platforms also provide patients with the ability to provide informed consent on the use of their data. That is one opportunity in which entrepreneurs can be a major driving force. You know, we've encouraged, and we're encouraged by these early initiatives, but we see that there is even more opportunity for innovation, collaboration, and opportunities that are good for business, good for health, good for social change. Now, we're founded on a vision of better business at the Robert Wood Johnson Foundation. And we've been open to working with business since our founding, knowing that our founder is Robert Wood Johnson, one of the brothers of the Johnson & Johnson company. That being said, we are very separate. We are a private foundation. We focus on the public good. And to get to the point, we have a very, very different mindset than the private sector, even the NGO sector, in terms of what we need to accomplish. And so it's been an evolution to engage the corporate sector and put ourselves into the mindset that allows us to do that. And so I want to share with you 4 key ways in which we've had to adapt our mindset. First was to embrace new ways of working. We've learned that it's not about us, RWJF, being the business expert. We don't need to know every business. We don't need to know everything about that sector. And it's not about businesses knowing everything about health. It's about our willingness to collaborate. We've had to change our behavior so we can explore solutions collaboratively. Now, we've had to become more open-minded of business as a player in the social movement. We've had to become much more empathetic of their drivers. What are their motivations? What are their goals? Profit is not a dirty word. We've had to become much more optimistic about what's possible with a solutions-oriented state of mind and generative in terms of lots of ideas for engagement and partnerships. We've also had to become much more iterative and adaptive when trying and testing and prototyping engagement opportunities. Like Abby said, this is not about a playbook. This is about being much more organic and riding through where the discussions take us. The second piece is learning and growing together. Now, we have learned to appreciate the strength and expertise that each of these partners bring to the table. We believe in forming these complementary partnerships and learning from each other as we develop ideas. So I think the key here is really learning from each other and keeping open-minded about that. At RWJF, what we bring to each of these different collaborations are our research, our networks, our broad experience, and most importantly, our strong reputation and demonstrated success in working to improve health across this country. Two other things, building from a shared perspective. We've talked about this before, being able to find common ground and mutual understanding. And by being very upfront about this in the beginning, we're able to commit to the collaboration and be both intentional and accountable. And finally, focusing for impact. So we don't partner with everyone that comes to the door, and I doubt that everybody here does that. And so we've really had to focus on the key things that make the opportunity prime and opportunistic. The first, and I've heard some of this, is fit with our values. So what's the risk of engaging in this opportunity? What's the conflict of interest, even perceived conflict of interest? What does this mean in terms of our value around charitable purpose and the public good? What are people's views around proprietary information? All of these are fundamental and need to be talked about and discussed. The second is, where is there a need for a third party to shift the agenda? Do we at RWJF really need to step into this, or is this train moving? Do we need to accelerate this or activate it? And finally, spread. We want to see the kind of social change that we've all talked about happen across the globe, right? And so will this effort spread a culture of health to all, or will it only benefit a few? Those are the three things that we look at, and I'm excited to hear more and talk more. Thank you.
Thank you so much. I don't know about you, but I feel like I want to go for a run. Thank you. Last but certainly not least, Wendy Taylor from USAID.
Yeah, thank you. All right, well, I'm the fifth speaker on this panel, and I'm going to try to keep it brief because we have such a great mix of people. I think we could have some rich discussion. So I'm just going to give you a little bit of information on our approach. I realize actually I'm the one speaker in these 2 days that comes from the public sector, which is, of course, a key part when we think about shared value, a key part or key partner in that discussion. And so I'm going to give you a little bit of information in terms of our approach around partnerships and shared value. A few of our lessons learned that have really been emerging actually from decades of work with partnerships. And then just some a few thoughts that I had just in terms of some of the challenges that we're seeing. Really kind of throwing them out there is meant to spark some discussion. from the group. So yesterday, Mark Kramer talked a lot about, he kept talking about how aid agencies need to shift their mindset, and I almost felt as if it was suggesting that nothing's really happening yet. And I actually want to make sure I dispel any myths here. I mean, the aid agencies, we fundamentally agree that this does require a shifted mindset. But there is a lot happening already, and while we certainly have more lessons here, I think as we all do, I want to make sure it's clear that a lot is happening already. And at USAID, I can say that that this has really been kind of fundamental to how we think about new model of development. And we see working with the private sector as kind of key to our work. It's kind of fundamental to how we do business. In fact, we see it as a business imperative. And I think this was mentioned yesterday when we really even just look at the role of aid agencies. It has shifted dramatically. So we used to have aid flows into developing countries used to be about 70% of the flows into developing countries. That has been completely turned on its head. We are only about 7%, 7 to 9%. So 91% of funding flows going into developing countries are from the private sector. And not all of those funding flows are really focused on those who are most in need, the most disenfranchised, those who don't always have access to medicine. And so if we want to continue to achieve our development objectives, we need to make sure we find those spaces to align with those private sector dollars. And certainly the private sector has a unique and growing role to play in this problem solving. And I think there's one of the things that's exciting, and I think that creates real opportunity, is that that some of these economic shifts are making that more and more possible. So when you look at what's happening in a lot of across the world, just in pharmaceutical, med tech, you see the kind of core markets that have been sort of bread and butter for industry. The economies are slowing down. But the real growth opportunities, the growth markets, which our colleague from Broadreach talked about yesterday, are in emerging markets, but also developing countries. Pharma, med tech, some of the biggest areas of growth are actually in Africa. So pharmaceutical sales are expected to be $30 billion by next year and rise to $45 billion by 2020. There's huge market opportunities. So how do we capture that? Low-income markets are seeing unprecedented economic expansion. So we have business interests to tap into, and so we now need to think about how we best go about doing that. So working with the private sector is certainly not new to USAID. We've been doing it since our founding in 1961 by John F. Kennedy, and we've built many successful partnerships. I think just over the last 10 years, we have 1,000 partnerships. We've engaged 3,500 private sector players, leveraged $20 billion of funding, and a quarter of that is just in health. But how we are engaging the private sector is changing and is shifting. And I think one of the things that approaches we've traditionally done is we usually think about our programming, we bring in our implementing partner, and really kind of set up what it is that we're trying to do. And then bringing in the private sector player was almost a bit of an afterthought of, okay, now how do we engage the private sector? Well, we realized that we need to shift that. We need to actually bring that private sector partner to the table from the outset. How do you sit down with them and do that kind of co-creation, collaborative thinking, where we can find, where that sweet spot of shared value, of kind of that collective interest lies, where we can try to address some of these problems together. That is, I think, essential, but it's not always easy to do. And but we're trying to build that in kind of to the mainstream of how we are doing our development work. Just as a bit of an aside, when I was pulling together some of my thoughts for this discussion this morning, I was talking to some of my colleagues in our Global Development Lab, and they've really been pioneering this concept of shared value. And they've actually gone back recently and looked at all of the partnerships we've done in the last decade or so. And then they also handed them off to Brookings Institute, to George Ingram, who did kind of a similar look through all of these partnerships. And I think through both of those exercises, really seeing a good number of them already focused on shared value. I think our internal review, they found about 30% of our partnerships are already true shared value plays, and another 50% are really strategically aligned with corporate business interest. And Brookings found very similar numbers and assessment, with 83% of our partnerships aligned with strategic corporate interests. So it suggests that we're already kind of shifting and going in that direction. And we've got a number of lessons so far in terms of how we engage with partnerships. And one is that we think partnerships are most effective when you're engaging the core competency of the private sector partners. One example that I'll bring up is Coke, and you heard from John already, that sort of quintessential aha moment so many people have when you go into that last mile, some of the hardest to reach places in the world, and you can see a Coke on the shelf. Yes, there's cigarettes too, and yes, there's also beer, but Coke is the one we always often talk about. And so for years, the public sector NGOs were kind of badgering Coke to say, well, you've got to help us here. Why don't we just throw our drugs on the back of your trucks and you can get those out there? Well, Coke really is not a drug delivery company, and nor should they be expected to. They're optimized to get their Cokes out there. But we've recently come up with a partnership with them where we can tap into their core strength. We're not asking them to deliver our medicines, but we're really trying to learn how they have optimized their systems, their distribution channels, how they outsource getting products to that last mile. And we're bringing them in as partners with our medical supply divisions, or the country's medical supply divisions in Tanzania and a number of countries. We're starting to spread this model where they're really able to share their core expertise and helping build much more stronger supply channels and distribution systems and ways of going about this. And it's led to some tremendous improvements. And frankly, just having Coke come in there with Coke's expertise, a lot of our folks in the ministry, it just adds this level of credibility, and so it's been quite successful. But a second piece, just to mention in terms of lessons, is how do we keep scale and sustainability in mind when we design partnerships? And we know that that's such an important piece. We've seen lots and lots of partnerships out there, but not that many of them really can scale to the level we need them to, and be sustainable. And one that I'll mention, and this is something I'm really quite interested in, is it's a multi-stakeholder alliance. It's actually in the ag sector. So within USAID, our ag team and food security team developed the new Alliance for Food Security and Nutrition. And this alliance, they're engaging the private sector on sustainable agriculture development in Africa. And they've actually pulled together 45 private sector companies that have committed to making $3 billion of investments in African agriculture. But it's if policy changes can be made on the ground in Africa, and the enabling environment improved to be able to to sort of make it sort of in their strategic business interest to engage. So as part of this, we then need the African governments to make those policy changes. And so we are able to leverage our relationships with them. The governments have incentive if all of these private sector investments are going to come in. And we can then also bring other donors on board to be the catalyst to make a lot of these pieces happen. And to Ben and Kathy, we were talking about multi-stakeholder alliances the other day. I mean, to me, this is one where you've got lots of different players, all from the same sector, coming together to think about collectively how to make investments. And I challenge all of us to think about where a model like this could be used in health, because I think it could be quite powerful. You can see how something like that really could be both scalable but also sustainable. And then finally, I think it's just we believe that partnerships work best and will have the greatest development impact when they're built on notions of shared interests, shared value, shared risks and rewards. And it doesn't mean that the models of CSR or even corporate philanthropy aren't also important, but we think that that's where you can have much greater sort of greater impact. And another partnership I'll mention is one is, and I talk about this one a lot just because I've been absolutely fascinated watching it evolve over the last 5 years, and that's our Helping Babies Breathe partnership. And this is one, it was a multi-stakeholder partnership that brought together a number of players around newborn resuscitation, and one of the leading killers of babies in the developing world. And we have a device, neonatal resuscitators that are cheap and can be used in a developing country, but we know there's so much more that goes into getting a product used. There's a whole system around it. So we brought in a company that can make the devices, but also can make training dolls to be able to help train healthcare workers on how to use the devices. And American Academy of Pediatrics came in and developed the training protocols. And we had an implementing partner that could really kind of pull it all together and actually introduce these programs in countries. And this program in 5 years raised $58 million, so more than half of it came from outside of USAID. It's been introduced in 77 countries. It's scaling in many of those countries, so it really spread like wildfire. And I bring this up in part because the corporate partner here, Lærdal, which is a Norwegian company, they're a small company. This is really their first foray into markets in the developing world. For a company like that to figure out how to introduce a product and get it into some of these harder to reach markets, they didn't have the know-how to do it. But this platform really gave them a vehicle for getting their product into these markets. And it was so successful for them that they ended up developing a brand new business unit to develop new innovations for the developing world around maternal and neonatal health, because they saw that this kind of partnership and collaboration was really a valuable one for them to engage. So just quickly, just throw out a couple of challenges that we see in kind of putting together some of these partnerships, and particularly on the shared value side, is it's still finding that intersection of that kind of shared alignment can be a challenge. It takes time and efforts. We still have some of our own procurement challenges in being able to either move money fast enough, put together deals fast enough. I mean, we are, I think, just as impatient as our players on the other side of the table, and we're developing new tools to help us move those things faster, but sometimes it's still difficult to do. I think we need to find more wholesale approaches rather than just retail, because each one of these partnerships and interactions, So, first of all, we need to do it just for scale and, being able to find the big impact. But each of these partnerships, it takes time and effort to build every single one of them. And once you build the partnership, you then need to manage it. And so if we continue to do kind of smaller partnerships here, there, and everywhere, our teams get filled up managing those partnerships, and we're sort of missing that big opportunity for much greater impact. And so finding those larger wholesale opportunities like the new Alliance on Ag that I mentioned, I think really is worth that extra effort. And then I just will also mention, because we talked financing a bit here, is that I think this is one of the really interesting, exciting areas where we're going to see a lot of movement in the coming years, is how we leverage private capital. Whether we're talking impact investing and just coming from one of the big impact investing conferences in San Francisco a couple months ago, to seeing that field is shifting. All the major investment banks now paying attention to impact investing. That's becoming, I think, much more mainstream. Though we have a ways to go in health, but we're talking to banks on around innovative financing. We're seeing insurance companies and reinsurance companies stepping in and creative ways, even thinking about how reinsurance can help in addressing creating pandemic funds to prepare for future pandemics. And talking about social impact bonds. So there's a lot of really interesting ways that we're looking at engaging banks and impact investors and insurance companies, and I think that we'll have a lot more experiments and hopefully a lot more successes on that front. So I'll stop there, and hopefully we have time for a few discussion questions.